Regenerative stem cell therapy is a viable and many times superior alternative to surgery. It can also help avoid having to take medications for pain. Joining us now with more on how regenerative stem cell therapy can help reduce or eliminate whatever joint pain you may be suffering from is Dr. Dennis Lox, and he brought along with him his patient, Andrew Duncan. Gentlemen, good to have you both here. Dr. Lox, I want to start with you because I think there's still a little bit of misconceptions out there about regenerative stem cell therapy. How does it work?
Well, we have stem cells in our body that are natural repair cells. And one of the problems is that we don't have them in our joints, so we age. When we break down, we're not supposed to get better. So we can bypass our natural limitations by taking stem cells from an area where they're not really helping and putting them into an area that needs some help. That's what we do. All
right. Now, Andrew, what was not working so well that you thought, I need some help here?
So I was a former Division I college basketball player, and my knees had a lot of trauma.
I bet.
So I ran and biked a lot, and I was in so much pain and had about 90% mobility loss in my knee joint. And I was in a lot of pain, and I'd heard Ron and Ian on Sports Talk Radio talk a lot about Dr. Lox. My company advertises there, so I had some trust built up. So I went to Dr. Lox, got stem cells, and it's been 3 years now, and I play basketball 3 or 4 times a week. I have no pain in my knee. I have full mobility back, and really remarkable. I tell so many people about it because for me it was just such a great success story.
And doctor, I think there's some misunderstanding about these stem cells because we hear embryonic cells and we hear amniotic cells. You're dealing with your own patient's stem cells, correct?
Correct. There are certain rules in the United States by the FDA, and one rule is in order to call it stem cells, it has to be the patient's own cells the same day. Outside of that, it's a drug, and so only certain things are approved as stem cell drug therapies. There's a whole nother niche that has to do with newborn tissue. Embryonics are before you're born, and then the perinatal tissues are umbilical, amniotic, placental. These things are regulated as tissue grafts, and so they're actually grafts for like wound therapy. If they were a pure stem cell product, it would be labeled as an FDA drug, and they're not approved for that. So there's just a lot of confusion over the whole subject.
Right. And you had one case of this where they put in your stem cells and
yeah, so I had it done in both knees, and I would say within about 4 weeks I started to recognize dramatic change in my mobility and pain-free in the joint. And I've gone back for, you know, preventative maintenance type stuff with Dr. Lox to get his treatment, but one stem cell injection, I was there maybe an hour, not a lot of pain, pretty easy process, and definitely something I wish I would have done even sooner.
Wow. Okay, and doctor, I'm sure there are people out there who are watching who are thinking, oh, my doctor said I need a knee replacement, or I need a hip replacement, or I need this replaced. Are these good candidates to come and at least see if this is an alternative for them?
Yes, I see quite a few people who are already on the surgical schedule. And that's not to say that every patient is a candidate, but you can at least talk to them and decide that. And it's a decision based on each individual patient. There's no umbrella for everybody. But a lot of people are not giving other options, and so they're never even told about stem cells. So it opens up a whole new avenue for people.
It certainly is, and I'm glad you're doing so well. That's fantastic news. For more information, call 727-462-5582 in Tampa Bay or 310-975-7033 in Beverly Hills. You can also log on to drlox.com. Dr. Lox and Andrew Duncan, thank you both very much.
Thank you.
Thank you.
Daytime will be right back.